being able to keep your condition and to keep your insurance. That's exactly what our bill does. Is if you want to enroll in Kaiser, you can do that. If your husband wants to enroll in Blue Cross or whatever plan, he can do that too. We also tell people that, your husband is lucky that he wasn't told by his insurance company that his cancer would be uninsurable under his new insurance, because that happens a lot. In fact, I have a friend. Well, yeah, but our bill says you can't do that anymore. Someone had cancer before, and you get a new insurance plan, they cannot exclude coverage for that. With respect to taking insurance across state lines, that's exactly what this exchange is going to let people do. And finally, with respect to the people who are here illegally, the bill specifically says that we are not covering, but the bill doesn't apply to people who are here illegally. So that's not what we're talking about. No, ma'am. The bill does not cover people who are here illegally. Period.
But if they go to the emergency room, they have to get treatment in the law.
Let me just say, though, that we're going to have, but no, the insurance coverage, exchange, everything I've talked about today is available to people who are here legally. Having said that, and I need to be very clear on that, because there's a lot of misunderstanding out there. Having said that, you're right, there are a lot of people who are here in this country illegally. The first question that was asked, one of them, was about immigration reform. And what I've been saying is, so this insurance reform bill that we have may only cover people who are here legally, but we have to figure out what to do with all these other folks. And I'll tell you why. Let's say you're sitting on the bus and you're next to somebody who has the H1N1 virus. That virus is not going to discriminate between somebody who's a citizen and somebody who's not. So I think the next step we need to take later this fall is we really need to enact a comprehensive immigration reform bill. And because that way, everybody who was here would then have some kind of regular order. Right now, what we've got millions of people who are here in this country with no legal status, and so they don't get health care until they get really sick. I don't want my kids sitting in school next to folks who don't have well child visits. But yeah, we've got to get some control of it.
Well, how do you get control of it before you ask us to pay our taxpayer dollars to it? Because if it doesn't get controlled, consideration control.
Look behind you and all those people. Let's be respectful to them. I will say this. We have about 47 million Americans who don't have health insurance. In addition to that problem, and so therefore, what we have to do is we have to address both issues. It's not an either-or situation.